about week 4? What happens during our head and neck cancer radiation treatment in week 4? Our patients may experience side effects and symptoms that include dry mouth, as the fields of radiation are impacting and changing the saliva glands. They may also include something that is called odynophagia, which is pain with swallowing. Pain with swallowing may occur at the back of the tongue, along the lining of the throat, or as the food glides down. They may even begin to experience a side effect called dysgeusia. Dysgeusia is the loss of taste or changes of taste. Certain foods may not begin to taste as good as they did. So the combination of dry mouth, pain with swallowing, and changes to our taste buds results in something else. It results in our patients not wanting to eat and drink as much, known as dehydration or malnutrition. This is why a registered dietitian is so important in your care as the patient. The registered dietitian is going to encourage you. What are some supplemental options that you could drink or eat to keep pushing you through your treatment? Week 4 becomes challenging. It becomes challenging for the patient. It becomes challenging for the caregiver. You've now shown up and you are going to have finished more than halfway through your treatment at week 4. All we need you to do is keep showing up. Even if you're not smiling, just come, and we will be able to continue as providers to push you through your treatment, encourage you on a day-to-day basis so that you know what you're experiencing is normal. Sometimes the skin will want to begin to break down. You will see some increased redness or dryness in certain areas of the skin, as well as you may be experiencing side effects inside the mouth. That could be considered mucositis. Mucositis is a side effect secondary to either the radiation or the chemotherapy or the combination. When mucositis arises in the mouth, there are sores. Those sores line the tongue, the gums, the cheeks. They also can consider lining the roof of the mouth, even along the posterior part of the oral cavity or oropharynx. So mucositis causes significant amounts of discomfort and pain when food touches it. What do you do about this? Well, your physician is going to make a suggestion to you. Mucositis is managed by your physicians. Speak with them about these concerns and questions, and they will potentially offer you a medication to help manage the side effect of mucositis. Keep an eye on your tongue, on your lips. Keep an eye on areas of soreness or tenderness. From an exercise standpoint, many patients at this point have either stopped doing their exercises when they see me, or I'm saying, just swallow hard. When you swallow, I need you to swallow hard. So we are picking and choosing our favorite exercises for our patients during this time. What about the patient who feels like, I don't want to eat or drink anything? Those patients are at a high risk for concerns of hospitalization. Nutrition is number 1 to get you through your treatment. Here, during weeks 4, if your patient does not have a feeding tube, there may be concerns arising for placing a feeding tube if nutrition cannot be sustained. A feeding tube is helpful for nutrition and hydration during the treatment. If you can take it by mouth, we want you to. As speech pathologists, we want you swallowing and continuing to try to eat and drink. But if you need the support, your team will make that decision based on your lab work, based on your weight, and how you are going through your treatment. Every one of our bodies reacts differently, and it's not predictable. So you have a team. Don't hesitate to ask us any questions so that we can help you navigate week 4 of your treatment. Keep showing up.